I'd like to quickly introduce myself and our guest speaker for tonight, which is our very own Justin. So my name is Chris Kapreski. You all have probably seen me before. I'm an undergraduate at Emory University, and I work with Dr. Krishnan's research team, which has partnered with the amazing support group here. Dr. Krishnan's research team focuses on what we call patient-centered outcomes research. So some topics that we study include comparing effectiveness of rehab following stroke across various settings, the management of caregiver burden following neurological conditions, and the prevention and early detection of secondary complications following stroke. So I'd like to now introduce our guest speaker, Justin Joseph. Now, you've probably seen Justin before on these meetings as he is a part of the amazing leadership team here at Young and Restless. And so we're really excited to have him give a talk this evening. Justin is a third year undergraduate at Emory, originally from Westfield, New Jersey. He currently pursues degrees in both economics and public health on the pre-med track. And Justin's current research looks at complementary integrative rehabilitation medicine and defining stroke in young adults. He has held past research positions at the Icahn School of Medicine at Mount Sinai, New York, where he investigated head and neck cancer. Justin is very active in his local communities, both at Emory and beyond, mentoring students from Atlanta public schools and young leaders through YMCA civic engagement programs. Justin believes today's issues require an interdisciplinary approach to create the change that we want to see. So before we start, I'd like to just remind everyone to please mute your mic during the presentation, unless of course you have a question or a comment, and this will just help us prevent any unnecessary noise or feedback. So I will now hand the mic over to you, Justin.
Thank you so much, Chris. I really appreciate the kind words. Let me share my screen. I don't know if can everyone see it all right? Let me know if, yeah.
Yes.
Yes. Okay,
Looks good.
awesome. So yes, so my name is Justin Joseph. Today I have really the privilege and the pleasure to present to you my presentation entitled Young Stroke, Beyond the Disease and What Are We Missing? I'm really excited to present some of my findings and my research to you all. I've really enjoyed the privilege to be part of your group and really hear a lot of your stories, and it kind of propels me to continue doing the work we do because I know it really does have an impact on people. And I'm going to go a little bit into that and what that means to me. Um, so specifically about me. So as Chris said, I'm an undergraduate researcher here at Emory. And I kind of want to talk a little bit about my story and what research means to me. I started ever in high school where I kind of fell in love with science. Science for me was kind of explaining the abstract, the unknown, and I loved how I was able to learn about new things by using knowledge, reading and hearing, and science for me just kind of clicked. And when I got to university, I really wanted to use science and my love and passion for that to really make a direct impact. And I saw that in healthcare and medicine. And when I first got to school, I was looking and seeing how different proteins and different chemical symbols that I didn't even understand, that was almost foreign to me, and trying to treat cancers and other illnesses. But I never saw how it impacted people. I never saw how it affected patients. And it always made me feel I want to make a difference, but how do I do that? And about a year and a half ago, I met Dr. Krishna and I found our patient centered outcomes research. So, what that means to me is that we have a direct impact in trying to make the lives of not only our friends and families, but our communities better by focusing on the perspective of a patient and our objective to improve the lives and health outcomes. And that really kind of spoke to me in terms of what type of research I do and I spend my time in. So, what are we going to be talking about today? And I kind of want to start off just explaining the type of research this study I was doing. So, I'm completing a systematic and scoping review. And in a sense, I'm a detective. My job is Detective Justin to search the web and databases and all the published research out there concerning young stroke. I've defined young as being someone between the ages of 18 and 65 years of age, because that's kind of what the guidelines have said. And specifically, anyone over the age of 65 can enroll in Medicare. So that can have some effects in terms of cost. And I am trying to compile all the research that's been done to create a research paper that's comprehensible and informative. I think all too often research is meant for the healthcare field and filled with jargon that really hard to understand for the people we're trying to help at the end of the day. And that's people in this call. We're trying to improve the lives of individuals, and by providing the research I do, I hope to make it easier to understand, more informative, and better benefit you at the end of the day. And that's kind of the research I conduct. Some of the things we're going to talk about today, I'm going to talk about epidemiology and prevalence. These are kind of the cornerstones of public health research because it explains to us how prevalent a disease is in our local communities. It provides the why of why we need to research what we're researching. It's crucial in understanding public health policy, helps increase funding, and important to say where are the gaps of understanding by understanding the data. Another big thing, and I'm really excited to talk about, is understanding the disparities and differences in terms of gender and race. And that is really prevalent in young stroke. Um, and I think we're going to go into that, and I can't wait for a discussion concerning that, but that's something I really can't wait to get into. Following that, I want to talk about risk factors. I want to get into the modifiable behavioral as well as lifestyle risk factors that involve specifically young stroke. Following that, my favorite topic of the night is post stroke outcomes. I think healthcare does a really good job at treating the disease and illness. I think we do a really good job. But understanding the multifaceted post stroke outcomes of a survivor, I think, is sometimes missed and looked up. And there's a huge gap in understanding. And I hope to discuss some of these outcomes, from mental health to getting back to work to caregiver burden to the cost, the economic strain and burden health might cause. As an economics major, I'm really interested in looking at those costs and how that can play a role in your rehabilitation. And moreover, the title of this presentation is "What Are We Missing?" I don't want to make this a lecture or me speaking for 1 hour, but I really want you guys to get involved. There's going to be some points where I'm going to kind of just stop and I want to talk about what I've learned and see what your perspectives are. I kind of hope you join me in this little journey we're going to take for the next hour. And please, if you feel comfortable, share with me your experiences. Um, all too often, as a researcher, I'm seeing what other researchers and people in healthcare have posted, but I'm not able, excuse me, to see the survivor's perspective, the individual's perspective. And opportunities like this provide me that opportunity. I want to hear from you how we can do better. Where can we improve? I think that's super important in providing better health. We're going to get comfortable being uncomfortable. That's something I kind of want you to remember throughout the presentation. Um, I'm going to try to do my best. We're going to have a little fun, and I hope you're excited for our little talk. So, what's next? The two main strokes, and we all have different strokes, and they're all specific and case by case. But some of the strokes I want to talk about, or I'll be talking about, is ischemic stroke and hemorrhagic stroke. And I just want to kind of define those before we get into it, just to kind of explain. An ischemic stroke occurs when the blood vessel supplying blood to the brain is obstructed. This is the most common stroke seen in young adults. And on the other side, there's hemorrhagic stroke, a little bit more serious type in terms of severity stroke. This occurs because of weakened blood vessels that rupture and bleed into the surrounding brain. Two words I'm going to use is intracerebral hemorrhage, which is when blood vessel ruptures and the blood enters the brain tissue, as well as a subarachnoid hemorrhage is when a blood vessel ruptures and that blood gets stuck between the brain and the skull. So I want to, oh, excuse me. So I kind of want to start with understanding the data. I think this is super important, as I said before, because this promotes the why. Why do we care? And incidence in young stroke is actually really interesting to understand. 2 million young adults have an ischemic stroke yearly. That's 2 million individuals. 2 million people have a stroke. And of the total strokes that happen in our population, 1 in 10 strokes concern to young adults. However, what's interesting about this? The number of individuals who are over the age of 65 who have a stroke are actually decreasing. That's actually really good. However, what's interesting is the number of young people, the number of young adults who are having a stroke are increasing. That really kind of pursued why I'm studying young stroke. The graph on your left hand side, I kind of showed from 2010 to 2015, there was a 40% increase in the number of individuals. For a public health disease, that's a really big increase and something we should really be understanding. And that's only over 5 years. So some possible reasons also, what I've seen was the incidence of stroke could be increasing because of the advancement of techniques such as like diffusion weighted MRIs, as well as understanding of the risk factors. So we're better able to diagnose a stroke. Therefore, the incidence increases, if that makes sense. So that was kind of one of the biggest rationales. Our technology and understanding of stroke has gone better, so we're better able to diagnose a stroke. So one of the biggest challenges in healthcare is diagnosing a stroke because sometimes it could be seen as many other illnesses when you present symptoms. So talking about this same idea of incidence and how prevalent it is, I kind of want to talk about some of the disparities that are kind of seen in young stroke. Big one and big difference is male and female. So ischemic stroke is greater incidence for young adults in males than females. Excuse me. However, for a more severe type called subarachnoid hemorrhage, as I defined before, there's a greater incidence in females than males, which is kind of interesting. Why does that happen? That's kind of something I'm trying to investigate still. In addition, younger age women are more likely to have a stroke than their male counterparts, which is interesting. Why are these younger age women more likely to have it? That's something the data is showing and we're investigating. Another really big thing I'm really excited to talk about, and what I've kind of discovered on my own, is how race can play a big role in terms of young stroke. Um, I want to start with a study. One study had about 84,000 participants, and it showed persistent racial disparities in stroke hospitalization. Rates of hospitalization for people below the age of 65 increased over time. However, this only occurred for African Americans and not Caucasians. There was actually a 17% increase for African Americans, and the rate for Caucasians did not change. In terms of incidence, African Americans aged 45 to 54 years of age were 4 times more likely to have an intracerebral hemorrhage compared to their white counterparts. 4 times more likely. Another study showed African Americans between the ages of 45 to 54 die of a stroke at a rate that is 3 times greater than their white counterparts. According to a study to the reasons for geographic and racial disparities in stroke, it's called the Regard study. This looked at stroke incidence and mortality in about 30 participants over the age of 45 from ethnically and demographically diverse samples. So it was a really good quality study. And the findings suggest that the higher risk of death from strokes is most likely due to higher incidence. And 3 times more likely was a very interesting number to see. In addition, across all stroke types and ages, African Americans had longer hospitalization times. Oh, excuse me. African Americans had longer hospitalization times, greater medical complications, and death from ischemic and intracerebral hemorrhages, and less likely to be, oh, excuse me, and less likely to be discharged to their homes compared to their white counterparts. In addition, the higher prevalence of stroke of risk factors, including hypertension, diabetes mellitus, and smoking in young and middle aged African Americans, is perhaps the most important contributing factor for the excess stroke in African American population. Excuse me. One more thing, and as an economics student, I was so interested by this. I want to talk about the cost disparities between African Americans and their white counterparts. Charges associated with racial disparities for people under the age of 65, our young stroke population, was equal to $361.5 billion, which can allude to there is a higher cost for people of color compared to their white counterparts when compared to hospitalization. $361.5 billion. It's important to note this number just accounts for their time in the hospital, acute care costs. This does not take into account their post stroke services and needs for successful rehabilitation after the hospital. In addition, another study inspected this and looked to hospital charges attributed to racial disparities. And they saw in individuals less than 65, this was equal to 22.72 million. And when they looked at their older patient population greater than 65, this was equal to $3.95 million. Just to show how young stroke is really interesting to investigate compared to an older population. In my research, this can also be attributed to the difference in insurance availability. So younger individuals are more likely to have private insurance or not even be insured compared to our older individuals, which can be enrolled in Medicare. So I kind of just spoke a lot, but I kind of want to pause. I kind of want to talk a little bit about what we just learned and kind of hear your perspectives. Does anyone who identifies as African American or agree or disagree with what I kind of said? And how did this make you feel? Or does anyone kind of have similar situations when they were in the hospital? Um, I don't know if anyone wants to kind of share their experiences if they'd like, or type in the chat if they feel better. But I'd love to spend a few minutes kind of talking about this. Let's talk a little bit about risk factors. The biggest takeaway from this slide is these are modifiable risk factors that kind of help in our prevention. And I know many of you have had a stroke, but I hope that maybe one of these things you remember and we talk about it with our family, our friends, our neighbors, our communities. Decrease overall health, increase overall health within our communities just by learning and understanding. Um, there's been an increase in prevalence of risk factors in young adults specifically. And these are just a few of the ones I liked and I wanted to talk about. So the first one, obesity. So this study looked at data from 1992 to 2008 from Baltimore, Washington, D.C. for young adults. And it showed there was a statistically significant, so it was very clear correlation between the increase in your BMI and your risk for stroke compared to healthy people. In addition, this study also looked at disparities as well and saw that African Americans who are obese compared to their white counterparts who are obese were 22% more likely to have a stroke. So given that they were both had a BMI, a greater BMI, African Americans were more likely to have it, 22% more likely. With respect to gender, same idea, obese males versus obese females, males were 25% more likely to have a stroke. So I don't want to sound like Dr. Oz, but I think you heard it here first from the Young and Restless. I want to give you some things I've learned and I want to take away in terms of diet. We're going to learn a little bit more after this presentation with Dr. Krishna and our registered dietitian next month. But what is the literature saying in terms of improving diets? Studies show diets rich in whole grains, fruits, and vegetables have been shown to significantly decrease the risk of stroke. In addition, this is something to write down. If you all are interested, one study that looked at about 41,000 people saw a decreased incidence of stroke and recurrence for individuals who engaged in the Italian Mediterranean diet. This diet featured high intakes of vegetables, fruits, legumes, pasta, olive oil, and fish, as well as low intakes of alcohol and low intakes of Diet Coke, red meat, butter, and potatoes. So this summer, as I'm reading more in stroke, I used to be a very religious Diet Coke drinker, 3 or 4. Now I'm trying to stick to water, get on the Italian Mediterranean diet, lower my risk for not only stroke, but cardiovascular disease. So we'll talk a little bit more about this, but I thought that was interesting. And Dr. Krishna will kind of talk a little bit more after. Another really important one to watch is hypertension. Hypertension was shown in 40% of individuals with stroke, specifically in males between the ages of 30 and 45. Third, smoking. It's time to quit, ladies and gentlemen. Smoking, as we all know, is bad, but specifically for stroke, it's really bad. 1 in 2 individuals with stroke had a history of smoking. Quitting now really does decrease your risk for recurrence. Specifically for young adults, the use of illicit and recreational drugs has risen, and evidence show that these drugs have really great negative effects on cardiovascular disease and more frequently, stroke. Specifically, smoking of these drugs or inhalation of drugs has been a major risk factor for ischemic stroke. Some others I wrote here, these are specific to young stroke just to provide the information. One is oral contraceptives used by females. One study showed that women who engaged in oral birth control could account for the twofold increase in ischemic stroke. Migraines have been identified as not only a risk factor, but a possible cause for stroke in young adults. In addition, family history, 1 in 3 individuals with a family history of stroke will have a stroke or could have a stroke. Moreover, sickle cell disease, which is again very prominent in the African American communities as well. 25% of patients with sickle cell disease will have a stroke could have a stroke by the age of 45. And patent form ovale, which is a really complex word, but which is a heart disease issue, which happens when there's an opening between one of the chambers when there shouldn't be an opening between the chambers of your heart. This is the reason I put that there is because it's really specific to young stroke. This little deformity issue with your heart. It was seen about 1/3 of the patients, specifically young patients, compared to their old patients. This risk factor is really novel to the literature and can be seen through speaking with your healthcare providers. It's an interesting cause and risk factor. It's interesting. It's just because if you think that there's 4 chambers in the heart, between 2 of them, it's like imagine there's a highway going like the highway that shouldn't be created in the sense of blood going into the ventricle from the atrium. It's interesting. Any questions in terms of risk factors? Um, Anyone have any questions? Maybe the diet was kind of cool to me, for me at least. How well do these risk factors kind of resemble your own experiences? Did anyone, if they don't mind sharing, have some of these risk factors going previous before these stroke, or do these risk factors not even resemble your experience? What am I missing here? This is cool. Happy, I want to say hooray. Some interesting, cool fact. In-hospital mortality has decreased by a little bit less than 50% over a 10-year period. That's a really like great positive to see. That just shows that the research we're doing, the technologies that are improving, are making an impact in terms of mortality rates. In addition, length of stay for both ischemic and hemorrhagic strokes between the same period has also decreased. So there's even though there's a lot of bad, there's also a lot of good in terms of young stroke, and it. I just wanted to highlight that. That was a cool positive for me. So now we're going to talk a little bit about the post-stroke outcomes. This is something that's really important to me because I think these are kind of seen as the invisible deficits. Chris kind of talked to me about that. These invisible deficits aren't always treated, and they can kind of be lost. And I want to make sure it's seen in my research, seen, and we talk about it more. We're going to kind of talk about it a little bit. I really would like to hear your stories. I want to make sure I'm not missing anything in this puzzle. And I'm excited to talk about it. So let's talk. Young adults with stroke seem to have 3 times higher depressive symptoms, 2 times higher prevalence of anxiety than their healthy counterparts. In fact, stroke in young adults have a 3 to 6 times greater risk for suicidal attempts. It's truly sad, and these statistics are important that we highlight, not to show what the issues are, but to provide us the groundwork to make an improvement, to make a change, and provide the care that individuals so desperately need. Specifically, another study showed approximately 50% of the individuals who had young stroke had symptoms of depression. 66 had symptoms of anxiety as well. Sources of these anxiety based on the literature show about 48% is due to the anxiety behind return to work. Concerns over recovery were seen about 25% of the time, and childcare was also seen in about 17%. In addition, they asked patients how they felt, and 23% individuals reported denial, 27, like 1 in 3, reported anger and frustration, and 1 in 5 had low self-esteem. In addition, unfortunately, substance abuse post-stroke, specifically for young people, was seen about 1 in 10 cases. And I want to talk a little bit more about mental health. That's something I'm really passionate about, and understanding a little bit more. Um, so one experimental study, which is it was a really good quality study. So it took interviewed multiple individuals with stroke, and looked at the effects of psychosocial interventions and care post-stroke for young adults, and found two major concerns that I want to discuss with the group. One, and this is my own interpretation of the literature, it was this feeling in the trench, and the second was a lack and inability to access specific services. I kind of want to read to you a few things that I thought was important. The first one, feeling in the trench. There was a feeling of being left in the trench. There was a want for follow up calls. Patients had to take personal initiative in setting up their own personal follow ups because of the worries of concerning physical health. Some said the health services cared only about physical health, but not much about their mental or psychological well being. One participant was surprised why it took 2.5 years post stroke to be offered a peer support group, just like here. In addition, there was a lack in terms of accessing specific services. There was a lack of individual plans and long-term follow-up care in terms of setting goals, coordinating different providers. Kind of similar to what Ruben was saying. Yeah, there's a lot of hoops to jump through in terms of our healthcare system, and understanding those long-term plans can be really difficult. Many of them had distressing thoughts concerning returning back to normal life, and some even described their life coming to nothing because of stroke, and felt difficulty with dealing with these thoughts. The lack of interesting mental and emotional feelings made patients question the willingness for providers to help. The youngest patients said their difficulty in terms of participating in rehab with older patients, and found clinicians not understand the differences in interest in their concerns. So I kind of said a lot, but I want to kind of talk about it. And how has mental health played a role in your journey? Have I described all the facets correctly? And I know I haven't. And I know there's many that are still not talked about or not described in the literature. And I kind of want to take this as an opportunity to empower you all. If you feel comfortable and respectfully, if you would want kind of talk to the group about your experiences in terms of mental health. How can we do better? And that kind of, if you want to, I don't know if anyone wants to express any of their concerns or feelings toward mental health, so we can improve patient care. Let's talk about some other post-stroke outcomes. I kind of want to talk about. Number two is kind of fatigue. Fatigue, I think sometimes some healthcare clinicians might not always take seriously, but in specifically 41% of young stroke individuals have fatigue or report fatigue. And why do I say that? It actually has a very severe impact in terms of your functional outcomes. In terms of going to work, caring for your children, or living life, fatigue actually is very debilitating, and we need to look into this a little bit more. Did anyone feel fatigue in the room? You can raise your hand. Or did anyone have fatigue post stroke? Another really interesting too is the 5-year rate of recurrence for young strokes, about 1 in 10, which is still a sizable number. This can be attributed to those risk factors as we talked about. I think fatigue was really big, really big. Sometimes not always looked at properly. Another big thing was functional independence. Some of y'all, when you were going through your recoveries, might have heard of a Rankin scale, which is kind of a measurement to determine your independence or functional independence. And this is really good news. So they said the number of individuals who had a score equal to 2 or less than or equal to 2, which means a very slight disability, was seen from about 78% to 94%. So what that means is not that they don't have disability, but their ability to be independent for young individuals. Um, And that same study also looked at depression rates for those individuals and still saw from 28% to 46%. So these are still invisible deficits, right? Even though one might be able to function, be independent, it's the wounds we can't see, um, just like depression. In addition, the percent returning to work was about 1 in 2. That's something really interesting. Young stroke is affecting a working age population, and as a result, their ability to return to work is super important, or their want to return to work is super important. Just in the case of time, I could talk a lot more about post-stroke outcomes, but I just want to kind of, I don't want to keep you all too long on this. Another super important facet for me, and something that I really attribute my work with Dr. Krishna, is understanding all the stakeholders involved in an illness and health, right? And something Dr. Krishna taught me early on was understanding the caregiver's perspective. I always saw the patient. We focus on the patient, we treat it, and we help them after. But there's many other agents and stakeholders within that. And something I really was interested in was looking at caregivers. Individuals who have a young stroke are more likely to be discharged home if having a caregiver, compared to other inpatient rehabs and nursing skilled nursing facilities. Caregivers for these individuals were primarily spouses. Just to provide context, about 53% of young adults, their caregivers are their spouse. If they're younger, it's about a 25%, 1 in 4 are their actual parents or slash grandparents. However, one of the consequences of having a spouse or any kind of caregiver is that marital stress. One study actually showed 1 in 7 couples separated within 3 months post stroke. 1 in 7. And in addition, they looked at the marital stress that occurred in the hospital and in rehabilitation. And the staff actually reported psychosocial issues, specifically with conflict between the spouses, was seen in about 38% of cases. And in addition, to look at caregiver anxiety, that was seen about 43% of cases. So not only we talk about the mental health of the patient, but the caregiver anxiety is also very high, and investigating that. Um, and caregivers reported more emotional distress when caring for patients exhibiting more depressive symptoms and greater cognitive impairment post stroke. So I kind of want to learn, who are y'all caregivers? Are there any caregivers in the group tonight? One thing, this is a facet of young stroke I found interesting to talk about. I'm going to kind of go through this one kind of quick. This was delays in seeking treatment. This study that I'm going to mention was done right in our backyard in South Carolina and Georgia. It had about 42% of the patients had a delay in seeking treatment, which means they waited greater than 3 hours to seek treatment for their initial stroke. Based on this study, a greater portion of this was African Americans. They were 3 times more likely to report a delay in seeking treatment. The younger one was, the more likely they were to delay seeking treatment, which kind of goes against our own maybe ideas about it. Maybe we would think older people would be more likely, but actually younger individuals are more likely to delay seeking treatment. And in addition, there was no correlation in terms of one's education, their health literacy, their stroke knowledge, or how often they went to a doctor. There was no correlation between how quick they went to the doctor. Why is this important and why I'm talking about it? I think it's important that as individuals who've gone through a stroke, to share your experiences with loved ones, to tell them some of the symptoms you have, because early intervention can be key in improving outcomes. And it's important patients arrive to these opportunities early to reduce risk of post-stroke disability. Moreover, the reason I chose this study, this 42%, this study looked at veterans actually through the VA system in South Carolina and Georgia. And this was the best case example of a population who should have equal access to care, given the VAs given to them. However, there was still about 40% of individuals who had stroke who had a delay in seeking treatment. This kind of goes to show some of the other barriers to access to healthcare, if that's geographical barriers, education of understanding stroke, public health campaigns. One kind of quick tidbit: in terms of our total GDP, in terms of healthcare spending, only 2.5% is given to public health. So in terms of prevention campaigns, pre-COVID world, yeah, maybe but in terms of old world, it was only 2.5% was given in terms of prevention. And not even prevention, just public health, in that whole field of medicine. Even in this study, actually, 71% reported that they believe that their symptoms were based on something other than a stroke. Actually, um, so I thought that was a rather interesting study to bring up. And wrapping up here, I kind of want to talk about treatment in terms of rehabilitation. Um, One major barrier to rehab utilization was the inability to miss work, since young stroke affects a working age population. One study actually showed that someone um, who is retired or is able to return to paid work was more likely to utilize rehab. And in addition, this study also showed that those who were able to see family members or friends were actually more likely to utilize rehab. That was really interesting. And going back to my favorite thing, costs. Stroke rehabilitation for younger individuals can dramatically decrease overall long-term costs. Um, Stroke rehabilitation should be seen on a case-by-case basis, and by no means there's a one-size-fits-all. But one study showed that for younger individuals specifically, it should emphasize participation in fitness activities, getting outside. In this COVID world where we were very much cooped up inside, staying home, but getting outside can play a really, really positive role, and getting involved in activities to whatever your comfort level or ability level is can, and these plans must be personalized, but can really be appropriate rehabilitation technique. um, Without appropriate rehabilitation, this longer period with disability can result in large dependency costs. The economic benefit of rehabilitation for working age adults as you see on the screen, can be really beneficial. One study based on 31 patients in the NIH system showed a positive effect in lowering overall care costs for patients who engaged in rehab for a median length of 2 months. So $2 million if they engage for 31 patients over 2 months. It goes to show rehab can play a really positive role, not only in your functional and in your ability, but in terms of your wallet, in terms of costs. And with that, I kind of want to have this last slide. What's missing? These were some of the major facets. I didn't want to put everything down that I've looked at. I tried to shorten it up, but those are some of the major big ideas I've been looking at in terms of young stroke. And is there another facet or another area in terms of your journey you might want to describe? Maybe services rendered. How did you feel about access to certain types of services post stroke? Maybe could be a good leading question. Um, were they beneficial? Not so beneficial? What opportunities did you all have? Or really, this is kind of Q&A. I'd love to hear your perspectives.